Chapters 5 to 13. Write the sentence to describe the work of the specialist in each branch of medicine. Look at B, opposite to help you. Number 1, dermatology. A dermatologist specializes in disease of the skin. Number 2, rheumatology. A rheumatologist specializes in disease of the joints. Number 3, traumatology. A traumatologist specializes in accidents and emergency medicine. Number 4, pediatrics. A pediatrician specializes disease affecting children. Number 5, obstetrics. An obstetrician specializes in pregnancy, childbirth, and women's reproductive system. Complete the table with words from A, B, and C opposite and related forms. Put the stress mark in front of the stress syllable in each word. The first one has been done for you. Verb, specialize, noun, person, specialist, noun of the activity, specialty. Practice, practitioner, practice. Consult, consultant, consultation. Assist, assistant, assistance. Graduate, graduate. Graduation. Qualify, qualification. Find preposition in C opposite that can be used to make word combinations with the words in the box. Then use the correct form of the words to complete the sentences. Number 1, a pathologist specializes diagnosing disease, so examining cells and tissue. Number 2, a pediatrician must enjoy work with children. Number 3, an oncologist is interested in the diagnosis and treatment of cancer. Number 4, a psychiatrist must be good at counseling. Number 5, a neurosurgeon must be good with her hands. Make word combinations using a word from each box. 2 words can be used twice. Look at A, B, and C opposite to help you. Consulting rooms, general practitioner, group practice, health center, internal medicine, surgical specialties. Make word combinations using a word from each box. Look at A, B, and C opposite to help you. Associate specialist, house officer, on call, provisional diagnosis, radio pager, ward round. Match the descriptions 1 to 5 with the job titles A to E. Look at A and B opposite to help you. Number 1, Dr. Graham has been a pediatrician for 8 years and is responsible for treating the children admitted to Ward 60. Letter C, consultant. Number 2, Dr. Stewart has just started the 2nd year of her foundation program. Letter D, senior house officer. Number 3, Dr. Singh has started his training as a surgeon. Letter A, specialist register. Number 4, Dr. Phillips has just graduated and is working in a large hospital in Birmingham. Letter E, registration house officer. Number 5, Dr. Miller is in charge of the medical staff in the Birmingham hospital. Letter B, medical director. Are the following statements true or false? Find the reason for the answer in A, B, and C opposite. 1. A medical graduate becomes registered 2 years after graduation. False. Number 2. The system of training doctors in Britain is called the Foundation Program. True. Number 3. The name senior house officer is no longer used in Britain. False. Number 4. The consultant is usually the first doctor to see new patients. False. Number 5. When working in shifts, all doctors take turns to be on call. False. With the test of a pre-registration house officer describing her job, look at A, B, and C opposite to help you. When I get to the ward, the first thing I do is talk to the house officer who was on duty during the last shift to find out if there have been any new admissions. Then I generally see the charge nurse. He tells me if there is anything that needs to be done urgently, such as intravenous line to put up or take down. Later in the morning, I clerks any new patients, which basically involve taking a history. On Tuesday and Friday morning, the consultant does her ward round, and I have to make sure I'm completely up to date on her patients. After that, there are usually lots of things to do, like writing up request forms to blood test, and so on. In the afternoon, I have to prepare for any patients who are to be discharged the next day. They are usually happy to be going home. And then, of course, there are the lectures and tutorials in the foundation program on Monday and Wednesday.